Okay, welcome everyone to Group Dentistry Now's DSO Study Club webinar series. I am Bill Newman. I am going to be with you for this hour. Appreciate you taking time out of your day. We actually have some great information here. This is the DSO Study Club Industry Report, the key phone trends of 2022 from a dentist perspective. I'd like to thank Callbox and Dentacloud for being part of this today. We're going to give people a couple of minutes to file in, but we'll get going pretty quickly and give everybody about a minute or two, and then we'll go. We will stop at the top of the hour, so 3 o'clock Eastern. Hopefully you'll be able to stick around for the entire hour. This will be recorded or is being recorded, and the recording will be available this evening on groupdentistrynow.com or on our YouTube channel. So got some great info. I had the opportunity to kind of run through the slides earlier today, and some great data points. Really interesting content. So thanks for joining us today. Like I said, I'll give everybody a couple of minutes. And if you have questions throughout the webinar, please feel free in the Q&A section. There's a chat and a Q&A. Try the Q&A before the chat. I don't always get a chance to look at chat. I will try that as well, but questions go in Q&A. We'll try to answer those. I've got two full pages here of questions that came in, some really great questions from attendees. So we will try to answer all of these. If we don't get a chance to answer all of the questions that have come in, or the ones that you actually ask us live, Ford or Dr. John will follow up with you and can answer those questions after the webinar is over. So, all right, we're at 2:02 Eastern, so we're going to get things started here. Again, if you are here, you registered for the DSO Study Club webinar series. I'd like to welcome Ford Kirk. He is the Director of Strategic Initiatives from Callbox. And we also have Dr. John Maggirias. He is the CEO of Dentacloud. Welcome both of you to the webinar.
Yeah, thanks for having us, Bill.
I'm going to skip through here, and they're actually going to be your hosts today. I'm just going to kind of sit back, and I'm going to handle the Q&A at the end, but you're in great hands with these two. So again, this is the Callbox and Dentacloud Industry Report, Key Phone Trends of 2022 from a dentist perspective. I had the opportunity to kind of take a peek at the slides earlier today, and I think some of the trends are pretty interesting. So I'm excited to, get both hosts' perspective on what's trending, and I saw a couple things where maybe not exactly what I would have anticipated. So one other thing I'll mention is that, again, submit your questions. I know we got a lot of great questions ahead of time, but if you happen to hear something during the webinar and you have a question, just make sure that you put that in the Q&A area, and we will answer that. So without further ado, I am going to turn this over. Well, actually, let's let Ford introduce himself and talk a little bit about his background, and then we'll let Dr. John do that as well.
Awesome. Thanks, Bill. Yes. So my name's Ford Kirk. I've had the pleasure of being here at Callbox for almost 6 years now. And in that time, I've really worn a myriad of hats. One is just working directly with our dental practices, DSOs, learning how their practice handles phone calls, both from a marketing and operation perspective. And then also I've worked with our partners and our agencies and any marketing resellers or white labeled companies that we work with. So on a business-to-business relationship, more biz dev, have had the pleasure of working with those companies as well to learn more so how Callbox can help those industries or help the dental industry as a whole. So excited to share some of the high level trends today, and excited to continue to talk about how important the phone and how impactful it is going forward as well. So Dr. John, I'll kick it over to you.
Yeah, thanks, Ford. And Bill, thanks so much for having us as well. It's a great topic of conversation. Too often, not only south of the border, but definitely north of the border here in Canada. And I've had the pleasure of working with Ford and the Callbox team to help a number of our clients. But Dentacloud is a fintech company that created a valuation platform online for dental practices. We focus on selling practices to DSOs, and we are excited to always help our partners grow through technologies that are vanguard, like what Callbox has. And yeah, excited to be here today and discussing more about communication.
So I think with that, Ford, I'll let you take over.
Awesome. Thanks, Bill. So yes, today we're really going to focus on industry-wide trends impacted by the phone. So if you're not completely 100% familiar with what Callbox does, Callbox tracks, records, and reviews every single inbound and outbound call that comes into a dental practice to give insights both on an operational level of how the team is actually handling those phone calls. Are they booking appointments? Are there opportunities being met? And then from a marketing perspective, also identifying where those calls originated from, meaning the marketing source that drove that phone call. So we really took a look at 2022 as a whole and compared it to years past to kind of give you some insights and data for where the phone is headed or has continued to head in the past year. So hopefully this is going to be insights that you guys are able to take back to your practices, implement, and really push forward with. So to give you guys some insight, we have 5 trends that we're going to focus on. So we're not going to keep this behind a veiled curtain, but here are the 5 trends that we're really going to go through today. 1, we're going to talk about inbound phone call volume trends and some of the data that we're seeing there. We're going to talk about connection trends. So we'll go into the difference between just a phone call and connected phone call and the trend data we're seeing there. Then we'll talk about appointment scheduling trends and even hit on new patients specifically. And then also mainline or main phone number trends. And then finally, we'll wrap up with holiday weekend trends. So a lot to unpack here. Really excited to dive into each and every one of these topics. So we'll go ahead and first start about inbound call volume trends. So in 2022, as you guys know, a lot of dentists or a lot of groups decided to increase their marketing spend as opposed to coming out of the pandemic or coming out of COVID. They decided to change that or to try and acquire new patients through marketing means as well. But there were still challenges with staffing. There were still seasonality challenges as well. But that directly tied to kind of the inbound call volume that we saw. So overall, here's the past 4 years of inbound call volume. We saw that there was a spike in 2021, and that's because of a lot of deferred care that took place in 2020. So we saw a large inbound phone call increase. And then in 2022, we saw that it typically leveled out a little bit, similar to the 2020 trend, but still more annual inbound call volume per practice and more than 2019. So as you can see, we're still seeing the phone is a very important conversion method. So although there's more channels for conversion, there's always going to be chat, there's text, there's form submission. The phone still is increasing, in comparison to every year other than 2021, which is a little bit of an anomaly. And it's still an important, very important asset at the practice. So Dr. John, as someone who is a practice owner himself and previously has owned a lot of practices and has worked directly with dentists in your current role, did this surprise you from what you saw, or was this in line with what you were thinking would take place?
Yeah, no, I think the data point that really surprised me is when you compare obviously 2019 to 2022, and there's clearly an appetite here for more of a personal touch. I think the pandemic may have created some apprehensions in people, maybe the great resignation and people shifting around with jobs. And maybe people are now looking for dentists more. And I think having that personal touch when you start thinking of dentistry and how invasive it is, or the anxiety that kind of comes along with that, nothing will replace the phone. And I think that's very important for people to understand and appreciate. Like you said, Ford, yeah, you can text, yeah, you can do all these types of forms, but hearing someone's voice is really important and a really powerful message in selling your practice, because it all begins on that first phone call.
Awesome. We also want to highlight the monthly trends that we saw in 2022. So per month, the highest call volume in 2022 was March, June, and May. So those 3 months had the highest call volume. And on the other end, the 3 months that had the lowest call volume were February, July, and December. Now, a few things that stuck out to us when we were reviewing this data. Okay, February, that's not overly surprising for, okay, it's the shortest month, fewest number of business days. That's probably going to lead to lower call volume. And then December as well, you could think of, okay, well, that's a holiday that lasts 2 weeks. Typically, a lot of practices are closed during those weeks. A lot of families are already traveling or unable to book, or clients are not able to book during those weeks. So those really add up. But it was surprising to see July as a lower call volume trend, and that could be attributed to one, that May and June were higher call volume. So if a lot of call volume is taking place at the beginning of the summer and those summer appointments are booked out, there's going to be a correlation where eventually it's going to peter out, and that looks to be the case in July. But also, it's interesting to see that, you know, as these summer months come, as we're approaching May and June, this is really tangible for your practices. Okay, we're a month from May and a month from 2 months from June. This is great to know as we head into those months, that those 2 months were some of the highest call volume from the prior year. So as we kind of go into this summer, as patients are calling to their schedule for their kids, or with their extra time that they might have, those 2 months could be a great opportunity to really hone in on the phone and focus on making sure that those increase in phone calls are actually handled properly at the practice. Dr. John, when you see that the February, July, December lowest call volume months, does that align with your practice and what you typically expect on your side?
Yeah, I mean, I look at this more from our client's perspective, obviously now being more on the M&A side of dental practices and looking at what quality practice do to help them get, you know, maximum value. Yeah, I would say they're in line. I'd be curious, it's a bit of a tangent, but how does it compare in previous years? If you look at 21 or 19, are the highest call volumes and lowest call volume months typically consistent, or is this something that's an outlier here for 2022?
Yeah, no, that's a great question. I think that we can confidently say February and December are always going to be on the lower side. I don't have the data in front of me to say that July has consistently been there, but I would be curious to see if that's a trend that we see this year as well, to see if 2023 also is one of the lower call volume months. And then also if June and May continue as well. So we'll just have to keep an eye on that, but a great insight.
I think the other thing that, for another point that I wanted to make, would be interesting for some of the call box users to see maybe just do some screening on the calls where there's lower volume and kind of hear some of the questions that are coming through. But no, interesting trends, that's for sure.
Yeah, absolutely. So we couldn't give you the full month without also highlighting the days of the week that also saw that increase. And no surprise, Monday, a lot of practices being closed on Saturday and Sunday, and some even being closed on Friday. Monday is going to always be the highest call volume that we see, and this is consistent year over year. And then following Monday, we know that Tuesday and Wednesday are right there alongside it. So the first half of the week is going to be higher call volume. More patients are going to be calling in to either update their existing appointment they may have scheduled, or finally schedule that appointment that they have on the books. But this is just great to know from a staffing perspective. If you guys are looking to adjust schedules based on call volume, or wanting to make a tactical approach to scheduling your team, knowing that Monday is the highest call volume day, making sure that you have as many agents available or team members available to handle that influx of phone calls can be very helpful. And then as the week progresses, looking to offer or start to have a lighter team heading into, you know, Thursday and Friday, especially if you guys are open. And then just because these three are the highest call volume, that doesn't mean that Thursday and Friday, or even the weekends if you're open, should be neglected, because we still do see new patient phone calls come in on those days. And this is actually a trend that we're excited to map and measure as we continue to see, okay, is Monday going to continue to be that leader? We imagine so in 2023, but will Tuesday and Wednesday follow suit, or will there be any kind of mean or adjustment to the mean that the other days kind of level off and there's a consistency there? So in recap, we have March, June, and May as the largest or highest call volume months, and then we have Monday, Tuesday, and Wednesday as our highest call volume days. So we've talked about months, we've talked about days, and now we'll tell you the hour by hour. So when looking at the day of, or the hour by hour, when call volume is at its peak, meaning when inbound calls are coming into the practice, 10 a.m. is actually the highest call volume time. So this is actually across all time zones. So 10 a.m. Eastern, 10 a.m. Central, 10 a.m. Pacific. That's the highest call volume that we see per hour for the day of the week. And then we also see 11 a.m. is the second highest. And then the third being 9 a.m. So early in the morning, again, if you're looking to make staffing adjustments or looking to make your efficiency optimum at your practice, having or making sure that Mondays at 10 a.m. you have all hands on deck to handle that influx of phone calls can be very beneficial. And also this can give you insights of when not to schedule team meetings or any specific training that you have for your team handling phones, because you know that these 3 hours are going to be the peak call time. So whether that's before the influx at 9 a.m., between 8 and 9 having a touch base, or right after the 11 o'clock hour, where that lunch break is, having a recap of all of the phone calls that have come in for that day so far, looking at a platform like Callbox to check, okay, do we have any phone calls that went to voicemail or hung up on hold, and having those insights to measure after these peak hours can be critical to ensure that the customer experience, for one, that has helped, and then also to make sure that no opportunities slip through the cracks. So Dr. John, when you saw that 10 a.m. was the highest call volume, did that surprise you more than 9 a.m., or is that something that you would anticipate, just knowing that the mornings are always the busiest time at the practices?
Yeah, it definitely did surprise me. I think I would, if I had to guess, 9 o'clock would be people want to get in if they have issues. But definitely that was a surprise. And one thing that comes to mind for me here is if 10 o'clock is a consistent trend, it'd be interesting to incentivize staff to really be on guard, so to speak, to answer the phones, and also do some call sampling, right? That'd be another thing to look at and make sure that the customer service is maintained, even though when the volume goes up. But that was surprising, that's for sure.
Yeah, absolutely. And are you, when you say call sampling, are you referring to like mystery shop or secret shop calling your own practice to see how they're handling at that peak hour? Or what?
Yeah, that's a great suggestion. I mean, definitely both ways. I mean, obviously the mystery shopping is a great way to do it, just so that you get a live experience on that. But I'm also just saying, randomly listening to calls that are recorded within the call box platform might be good to do from time to time, just to make sure that when things are really busy, your staff is still performing the way that they should be.
Absolutely. No, I completely agree. So moving on now, we will now transition to the inbound call connection trends. So the difference with Callbox and just saying inbound phone calls and inbound connected calls is Callbox measures a connected phone call as someone who calls into the practice and gets ear to ear with someone who can help them and ultimately book an appointment. So if I call in, I ask for Dr. John, and Dr. John's busy, and I get transferred to his voicemail, even if I speak to a receptionist, that's going to show up as answered on a phone system or in some reports. But Callbox actually will not count that as a connected phone call. So that connection metric, or that connect metric, is actually a really important metric to review regarding the customer experience, and also ensuring that the team is helping as many patients or potential patients as possible. So when looking at the connect trends, we saw that there's actually been an increase in connected phone calls in 2022 comparing to years past, and actually the highest since 2019. So this really could indicate a few things. One, with more of an increase in 2022, we'd imagine that staffing might be coming back to where it was in the 2019 levels, where we're seeing that more staff is available to handle these inbound phone calls. And two, that there's an increase or an increase in the amount of emphasis on the customer experience. More patients are calling in, but as we saw comparatively to 2019, but more patients are being helped. So the customer experience continues to reign supreme or be a very important metric that a lot of practices and a lot of DSOs are looking at to make sure that they're helping as many patients as possible, and where we're seeing that increase in connect. So Dr. John, I know that the connect metric is very different from answered. When you think of a connected phone call, what is kind of your baseline for, hey, I know that there's going to be some calls that come in after hours, but for if you were looking at a practice, when you say, hey, we really need them to be connecting as many calls as possible, does about 80% align with what you would expect for a top performing practice, or what do you think when you see this 79% here is a good benchmark for them to have?
Well, absolutely. I think that would be definitely, I think, on the upper spectrum. Obviously, it's always good to be higher, but I would fully expect that any practice that's above the 79% threshold is a top performing practice. And yeah, it's great to see that people are engaging again. And we were joking with Bill prior to jumping on this webinar about how the apocalypse is over and life can come back to normal. So it's nice to see that the data is supporting this from a call perspective. So it's nice to see.
Yeah, absolutely. And we're excited to see this climb as well, especially when a lot of times when we talk with dental practices and DSOs, they use kind of 2019 as the benchmark because the past 2 years were so unique. And seeing that, hey, this is actually higher than 2019 levels is a great barometer to look at, and a great kind of launching forward of, hey, let's continue to see an improvement here, continue to help as many patients as possible. So although we did see an increase, calls that hung up on hold is actually a metric that has steadily increased year over year. So in 2019, 14% of not connected phone calls or callers who were not helped hung up on hold. In 2020, it was 13%. In 2021, it was 22%. And in 2022, it was 31%. So we although we're connecting more phone calls, the reason those callers are not connecting, so that 21%, if we were looking at the last slide where we said we connected 79% of the phone calls, okay, what was happening on that other 21% of inbound calls? Almost a third of those calls are ending up hanging up on hold. So what that really indicates is that although some callers are being helped, there's still a lot of improvement that we can implement. And hung up on hold, a lot of that is process that can be implemented at a practice to help with that. So despite hung up on hold increasing, we do have a metric that I wouldn't say it's a rah-rah metric, because it does show that the average hold time is still 2.5 minutes, but it is the lowest that we've seen on our reporting. So great, it's the lowest, but being on hold for 2.5 minutes, it certainly seems like a long time. I'm sure if anyone who has been on hold recently can attest. So definitely an important metric to keep in mind as we think about phone calls, and especially when a phone call might be answered by a receptionist or answered by our front staff team and then transferred. During that transfer, when they're on hold for an exceedingly long time, that's a lot of where we see this crop up, or we see a lot of callers hang up on hold. So we're actually going to go into some tactical ways to help improve connection, but definitely wanted to highlight this first. So ways to improve that are kind of a myriad of reasons, but one is implementing a phone bridge or an IVR or an auto attendant. So what that really says is, thank you for calling. Press 1 if you're a new patient, press 2 if you're an existing patient, press 3 if you'd like billing, press 4 for all other options. And the goal of that is to really funnel phone calls to the department that is supposed to handle that. So for new patients, if you have a new patient team that all they do is book new appointments, maybe a call center, maybe a business development center, if you're a DSO or some kind of unit of individuals that their main goal is the booking new appointments and booking appointments on the calendar, having calls funneled directly to them instead of a receptionist that then transfers there can be really helpful, because they don't need to transfer between office location team members or between phones, and they can get funneled directly there. And then for existing patients, if that can go straight to a receptionist, that's great, because they can answer questions about rescheduling or answer questions about where the practice might be located. But allowing for those existing patients and new patients to funnel accordingly can lead to a lot more efficiency there and help with that connect score. And then also staffing. So if you see that you're consistently hitting a 50% connection rate, or your metric for your phone calls being connected are substantially lower than that 79% threshold, then maybe it's about analyzing, do we have adequate staff to handle the influx of phone calls that we've received? And do we have them staffed at the appropriate times? But a lot of times we kind of think about the phone call or a new patient as a transaction, but in reality, there's a lot of rapport that can be built. There's a lot of conversation that can be had on that phone call to make it a lot more of an easier customer or a better customer experience than just strictly trying to book them as quickly as possible and get them off the phone. So continue to build rapport, continue to get to know the patient, and continue to kind of build that trust with them through that initial inbound phone call. And then the last thing is the warm transfer. So a warm transfer on the callback side is where before you're sending or transferring that call to another team member, you first put that caller on hold and check if that team member is available. So you'll put them on hold, check if they're available, and then say, okay, I'm going to send you through to them now. And that allows for that warm transfer from, okay, before I just send them to that extension without even checking if they're available, I'll make sure that they are in fact able to handle this inbound phone call or handle this customer's needs, and then send that over, as opposed to a cold transfer where you just send that through at extension. So that warm transfer process can really help with that customer experience, because they're going to be transferred directly to someone who can help them. And then if they're not available, instead of putting them on hold and sending them directly to a voicemail, you can pick that call back up and say, hey, they're actually not available right now. Can I take a message that I can deliver when they are available, or is there anything I can help you with? So those are 4 key opportunities or ways to help improve that. And Dr. John, I'd be interested to hear if any of these 4 resonate specifically with you, or that you think is the cream of the crop in your humble opinion.
Yeah, I think the biggest thing to point out is when we look at practices that are run the most efficiently, I think having people with the right phone skills that know how to manage patients, through, as you mentioned here, rapport building, transferring, making sure that the patients are part of that process. I always would encourage team members to say, is it all right if I transfer you? Even though you have to transfer them, if they're part of that process and you communicate with the patient in a way that they're on your team and you really want to help them, and you're not just trying to brush them off, I think it goes a long way. And I think you've nailed it down really well here for folks to kind of learn from this and help their office be better on the phones.
Awesome. Yeah, and definitely feel free to take a screenshot of this, but we'll also have the recording available. But we're at Callbox, we love helping create those efficiencies out of practice. So if you have any questions on how we can help with that, we're more than happy to walk through that on a practice by practice basis, because we know there are intricacies and nuances to every practice, but we know that we can help out in one way or another, especially on the call connection front. Awesome. So switching gears from Connect, now we'll talk about appointment scheduling trends that we saw this past year as well. So we saw a decline actually in new patient opportunities scheduled from 2019, where it was 62%, to in 2022, where it was 53%. So we saw that 9% dip in new patients scheduled. So really, this can come down to a few things. One is we know that new patients are very much shoppers now. So that they'll call and they'll ask either for price, or they'll ask for, do you take my insurance, or do you handle my insurance? Or they'll call and say, hey, is there any availability tomorrow? So it's really important to know, or to understand, one, how you're presenting your brand on your website and through your marketing. And what I mean by that is if there are certain insurance providers that you don't take, for example, if you don't take any state insurance and you don't have that listed anywhere on your website, you could be getting an influx of new patient opportunities that are calling, asking about state insurance, but that's not something that you guys currently take, and could be a new patient opportunity that is not scheduled. Or if you guys are running, if your schedule is completely maxed out and someone calls in talking about how can we scale back our paid search advertising because we don't need necessarily brand new appointments this week or new patient opportunities this next 2 weeks, but we still want to continue our SEO and continue our other marketing campaigns while our schedule continues to open up. So being able to be aware of those levers and those consistent trends that you have at your practice. And maybe if you consistently see, okay, we're seeing a lot of callers calling about price. Is there something that we need to specify either on our website or through our marketing channels that kind of help mitigate those callers who call in about price and then ultimately do not book? So all of those factors kind of come together for new patients, especially from the new patient acquisition standpoint. But Dr. John, from your end, for new patient opportunities, what would you say to someone who says, hey, I'm having trouble acquire or scheduling new patient opportunities, and my biggest concern is they call in and they're asking about insurance or calendar? What would you say about that? And you're kind of helping them navigate those questions.
I think that definitely is what you talked about, just making sure that the filters that you put your prospects through, whether it be from web or digital marketing or even print for that matter, are set up properly. And it's important that you take that information that you can get from Callbox, and you are always reviewing that when you're developing your various campaigns. And so I think that's the power of looking at this data point here. And I think the other thing that you always want to be evaluating for your specific practice as you start to use these benchmarks, what makes your practice unique, and is this applicable? So there's different elements. So if you're a practice that is getting a lot of new patients through, say, text messaging versus the phone, if the phone numbers are lower, maybe you got to improve the phone skills of your staff. And so having a tool like Callbox can definitely help you with that. I think it's important to always be measuring and understanding what's going on with your practice. And there's no question about it. Obviously, the phone is, the lifeline of the practice when it comes to communication, making sure that you're in constant contact with whether it be new patients or existing patients.
Perfect. Exactly. And we actually teed that up because we talked about service availability, we talked about price, we talked about insurance and calendar, but Callbox actually is able to analyze why appointments are not being booked. And the two largest reasons why from 2022 was, one, service not available, and two, calendar availability. So service availability, that can really look like if you're requiring referral for new patients, or if you're requiring a specific step to be had before you can see emergencies or before you can do tooth extraction. Making sure that, again, that's hand in hand with your marketing. For example, if you are getting a ton of phone calls about emergency care, making sure that your paid search advertising isn't geared towards emergency or isn't geared toward tooth extractions or anything around that nature. If a first appointment where an evaluation is made is necessary before that service can be had, or if you're requiring referrals, making sure that's listed as much as possible on your website or through your channels can be very helpful there. And then calendar availability. This is another great kind of tactic to just ensure that you do have that list of callers who wanted an appointment, but you were already booked up, and you put them on a calendar list where you can immediately recall them if an appointment was canceled or if someone needed to reschedule themselves. And having that list to jump off of can be very helpful. And Callbox can provide that because we'll serve up exactly all the appointments that were marked as calendar as a not booked appointment. So you'll have that directly in Callbox, but not you're not leveraging callbacks, having a tool or solution that tells you, hey, these are the past 10 callers who tried to book, we didn't have schedule availability, and now when a patient is canceling, they're able to do so. So keeping in mind of why the reason patients are not booking can directly help you booking more new patients. So having that data, having that insight is incredibly valuable, and we want to make sure that everyone is leveraging that. So the top 3 days of the week, just like we talked about with Connection, for an appointment opportunity, if you guys are really locked in, you might be able to guess what these 3 days are, but it's the same 3 as Connection. So that's correlated there, guys, right? So if I'm connecting more phone calls or more phone calls are coming in on Monday, I can expect that more phone calls thus will be appointment opportunities on those days as well. So the more phone calls we receive, the more that we connect, the more appointment opportunities that we have, because we know that of those connected phone calls, the more that we connect, the more often than not, there are going to be appointment driven or appointment opportunities to be had. So that just goes hand in hand with that inbound connect metric and that inbound call volume metric that we talked about earlier on. So
Ford, I want to point one thing out there, if I may. So what's interesting is there are some offices that are closed on Mondays and are open on Fridays. And we see, Fridays typically tend to be the day that most offices are closed. But I think this was an interesting data point for any listener who's closed on a Monday. They may want to think about having some of the staff, the admin staff, come in and monitor the phones on a Monday, because the data here is pretty overwhelming. So that's just something that I wanted to point out as you start to think about days that you're open, particularly with summer coming up and tea times opening up. I think it's always important to keep these things in mind as you look at the data.
No, absolutely. Yeah, thank you for that insight. You're exactly right. You really have to think of it from a lens of your own practice, especially if your practice does have unique summer hours. And knowing that, okay, we're going half days on Mondays and Fridays now. Knowing that and knowing how the data falls, especially with Monday being the highest call volume and this first 2 summer months, May and June, being the highest in terms of call volume, those are all important insights that you can leverage to ensure that that customer experience is optimal and the best it can be at the practice. So we teased this one, then we went back, but hey, we're back again to the mainline trend. So Callbox identifies the main line as that main number that's associated with your practice. So that's the number that is used as kind of the number at the practice. And what we mean by that is Callbox provides unique phone numbers for marketing campaigns that we call our tracking lines. Some other companies might call them forwarding numbers or marketing numbers, but at Callbox, we use the term tracking lines. And so a lot of our practices that we work with will place these tracking lines or these tracking numbers on all of their marketing sources so that they can get marketing attribution from either Facebook or Google Ads or Google Business Profiles. They'll get all those insights, but we know that the main line or the mainline phone number is still getting an influx of phone calls for each practice. And we wanted to look at that in comparison to all of their sources. So this is a really impactful metric because we saw in 2022, a little over 54% or a little over 50%, 54% to be exact, of all of the call volume is coming from those other sources. That's the Google Business Profile, Google Ads, Facebook, Yelp, Yext, whatever sources you're using, but still 46% are coming from your main line. So a ton of opportunity is still being driven from your main line, even if you're not actively advertising it on your Google Business Profile or your website. Customers or callers are still calling from that mainline number that you have, and thus there are going to be appointment opportunities from that main line. So about 40% of your appointment opportunities in 2022 still came from that main line, whereas 60% drove those other sources or a lot of those appointments from those other sources. So if you're not currently tracking your main line or that main number still and getting insights on how that main line is performing, you're potentially missing almost 40% of those appointments that are coming in on a daily basis. So having the insights on your main line, tracking your main line is paramount to getting that whole picture. I mean, if you think about it, you're only really absorbing 60% of your appointment opportunities if you're not tracking that main number. So making sure that that main number is being tracked is very important. It's just like if you were to track, okay, let's track everything on the website, all our forms, all our chats, but we also have an online scheduler that they can schedule directly, but we're not going to track that. So it's a missing piece that's telling a little bit more of the story. So making sure that you're tracking that main line as well is going to give you that full picture from your phone's perspective of how those calls are being handled. And Dr. John, anything to add from the main line perspective there on your side?
Yeah, I think for people that are more getting into the analytics of marketing and understanding sources, I think it's important for them to appreciate tracking lines and the power behind them. I know everyone is always about Google and where people are clicking and your analytics and whatnot, but I think that's the one thing. Callbox has been around for a long time doing this with phones, and I think the power and the data that you guys have collected all these years can be leveraged by Callbox clients to really make sure that they're appreciating where their patients are coming from and where they need to spend money. Because as we all know, if you just spend money on a bunch of sources and you don't track it, you don't really know if you are. So I think this is a great point when you look at other sources and call tracking lines.
Awesome. Well, we know that the holidays are quickly approaching, and we just wanted to quickly hit on some important factors to keep in mind as holidays, specifically kind of these summer Monday holidays, and what we saw in the past year in 2022. So an average Tuesday has about 17 inbound phone calls on average. But what we saw is the day after Monday holiday, this in 2022, we actually saw a significant spike. So the day after Memorial Day, the day after the July 4th, and the day after Labor Day, we saw almost a 2x increase in inbound phone calls on those days after the holiday. So that's really impactful and really important for your practices to know that a lot of patients are calling after the offices closed for a holiday that day. Maybe it's they had a conversation and they're like, oh, I haven't been to the dentist in 2 years. I'm actually going to call them. Or they just had it on their list and they're finally going to check it off after a long weekend. So being aware of that, especially as we head into these next few months, can be really helpful to ensure that, okay, if we do have a closure on the day after holiday as well, that we can have the staffing still or the metrics available to still see how many patients attempted to call us that were not able to get connected and following back up. Or if you are open on that Tuesday after a holiday, making sure that you have an adequate team there to handle that influx of phone calls. So that was a really interesting tidbit of information that we found from this past year, that the day after holidays really did see a significant spike in phone calls attributed to their Callbox tracking lines. So this all kind of culminates to why should this matter to my practice? And I think I'd love to get Dr. John to chime in here after me, but for me, it comes down to two things. One is the customer experience. So you know that the dentists and dentists that are on here, you guys spend a lot of time ensuring that the patient has a lot of trust in you when they get in the chair, ensuring that you get to know that patient as a person and not just as another number that fills the seat. And that really starts on the phone. That starts the first time that they call into your practice or call to your DSO. So getting them or starting with that great customer experience is really going to benefit them. And that starts with connecting that phone call, helping them get to where they need to go, making sure that they're booked for an appointment. Those are all kind of things that culminate in that customer experience, having that rapport built, having that conversation. And the other is providing an avenue for metrics and getting insights onto, okay, how is the phone impacting me, or how is the phone impacting my practice in terms of a revenue stream? And viewing it just like you view your other conversion methods, and seeing that the phone continues to see an increase in volume year over year, especially as we rebound from 2019, 2020, 2021, and seeing that we do see more phone calls in the coming months as well. This can be a great springboard for action for you all. And Dr. John, anything that you want to add on to that from your perspective?
Absolutely. And I think from our perspective and why we connected with Callbox and Ford and Sophia and the group, north of the border in Canada, where probably 80% of our business is now done. Although interestingly enough, the first couple of deals we did at Dentacloud were in the US. But again, our focus lately with what's been going on in the market in Canada is really trying to help our practices grow and differentiate themselves to be able to sell when they're ready. And everyone, I'd say the majority of these practices have analytics that they're looking at for their website and Google and whatnot, but very, very few look at their phone trends. And I think today, Ford, you've put together a very compelling argument for everyone to want to be looking at their data from what's happening on the phones, because it's such a important thing to look at. And when you look at the sale of a practice and what it means to get an extra couple of bookings, even a week, and what that revenue looks like, it amplifies. And I think a lot of the key data here is going to resonate with a lot of people that are listening. And I highly encourage everyone to speak with Ford and the Callbox family. They have a ton of information, and definitely can, whether you're an existing Callbox client, and we have a number that we worked with Ford and Sophia and the group, or whether you're a new client looking to come in. I think the power of Callbox and the return on investment when you make that investment to have Callbox in your office is pretty clear.
Awesome.
So I think
yeah, we got some question and answer time. Bill, I think you had a few that came in before, and then we might have even had some more in the chat if we want to take on as many as we can in the next 15 minutes or so.
Yeah, absolutely. I figured I'd drop the Q&A slide so people could actually see us. Some great questions that actually came in. A lot of them you kind of look down, probably have a couple of dozen questions here, and some of them repeat, right? So we'll start with this one that actually came in early this morning. And pretty interesting. I don't think you touched on this, but certainly important. And how do you make the front desk team understand the benefits of call recording? So there's probably some apprehension if they've never had that before, and all of a sudden you're bringing in Callbox. So can you talk a little bit about that?
Yeah, absolutely. I'll start and then allow Dr. John to chime in. But the first thing is it's going to be a safety net for that front desk. So a lot of times, they're doing their job, they're doing it well, but a disgruntled patient might call in and claim certain things. And now with that initial safety net, that call is recorded, so they can go to their boss or their manager or their direct report and say, hey, no, that's actually not what took place at all. Here's the call, or here's the customer's phone number. We can listen back to this phone call and identify actually what happened. So it can be viewed there just from no longer a finger pointing, he said, she said, but a true kind of idea of exactly what took place on that initial call. So that's definitely one aspect. The other is it's a great opportunity, not necessarily from a this is what you need to say or have to say, but it's a great training tool with tactics. So if your employees are saying, hey, how can I get a raise, or how can I improve in my footing at the company or at the practice, having them listen back to some of their calls, giving them some coaching, and then having them be able to see where they can improve directly on that phone call, and then seeing them make that improvement is a great way in which they can say, hey, I've kind of given you this objective to improve on booking appointments. Here's how you can do that. Here's where you were before. Listen to a couple of calls. Here's where we are now. And that substantial improvement can be a really easy way for the team to show, hey, I've improved here. I'm handling phone calls better. I can be given more responsibility. So a safety net for one, and then also it can show that improvement over time, especially if people are looking for a more opportunity or looking to increase their responsibility at the practice. Anything that I missed that you want to add, Dr. John?
Well, I think that one thing you always want to look at is also just the personal element of it, right? I think you always want to have team members who want to grow and improve. And I think back to my formative years doing Toastmasters and doing public speaking, and we always recorded stuff, right? And you record things so that you can listen to yourself and you can pick up pointers. And I think that's a big part of it. But I think it really starts to, when you start to think about it, though, it's more of a cultural element that needs to be there. If there's a lot of trust built in the practice and the culture is there, I don't think people feel as threatened about, providing feedback, right? So I think it's the big thing is, evaluate the trust element and the culture of the practice, and then really position this as a personal growth opportunity just as much as it is about helping the business grow.
Maybe we should build on that question with one that was asked 4 or 5 different ways, but it was basically the same question regarding AI. So, is Callbox using AI? That's been the thing that everybody's talked about in 2022, right? Everything's AI. And I think there's some fear wrapped around that as well. So I'd love to hear both your thoughts on AI when it comes to call monitoring, and maybe beyond that as well.
Yeah, no, that's a great question, and it's definitely one of those hot button words right now. So Callbox does leverage some AI, but we really have found that a human intervention or a human listening to the phone call is much more accurate and able to pick up those nuances of a phone call. So there's, as you guys know, there's some subjectivity or how a phone call might be navigated by that individual call center agent or that team handling that phone call, where they might not directly say, would you come in for an appointment tomorrow, or will you come in? But the human is able to pick up on that. But where AI is really cool or really great is able to identify the team member that handled that call. So saying, oh, Bill handled 15 phone calls yesterday, or allowing them to pick up if the caller had a angry tone to their voice using sentiment analysis. Those, or identifying specific keywords that were said, such as, I want to find all the calls that had the word Medicaid in them, or Medicare, or HMO, or PPO. Callbox is able to use AI to kind of deliver on all of those things. So we like to say our AI makes our human reviewers or works together with our human reviewers to really offer more insights and give you even more details on exactly what's taking place on a phone call. So we're going to see AI continue in the space. AI is going to continue to grow. It's going to continue to develop. It's a matter of using that AI and the advancements in AI technology to improve the product and improve the efficiency to deliver what's most important. And that's, one, phone calls that were not handled adequately the first time, and making sure that we can follow up and booking more appointments there as well. So anything you'd like to touch on with AI on your side, Dr. John?
I always think of AI, you're right, it's getting a little more and more used in ways that we sometimes have a little skepticism about. But I always think of AI as a tool, not as a solution, right? I think AI has elements, whether you look at what's going on in radiology, whether you look at what's going on with some of the analytics. And I think that's the most important people can appreciate. It's not that you have an overlord that's listening to you. You really have tools that are in place to help automate some of the things. But one of the things that I think is amazing about Callbox is that they listen to every single call. And I think there's an element, a human connection there that's made to give the administrators confidence in saying that this isn't just some cold, matter-of-fact machine that's listening in, and it is what it is. I think that's really important for people to appreciate that AI is a tool. It's not a solution that replaces people.
Time for a couple more questions here. Should you use a script when answering the phone?
Yeah, it's a great question. I think that a script, we don't like to necessarily have a full script because it can be very easily kind of identified by the caller that you're reading off a piece of paper. But what we like to implement more so is like a ripcord or a call flow or a playbook for the team, where they know, okay, if a caller asks about a specific question regarding insurance, or asks about referral, or asks about specific niche questions, helping the team know the best avenue or the best response there. And first and foremost, a script does a few things well. It tells or it allows the handler, the phone handler, to say, okay, I know exactly what I'm going to say. I'm going to say this every time. I'm going to be fit into this kind of rigid structure. But what that really takes away is that unique customer experience where it's a lot harder to build rapport when you're reading off a script. It's a lot harder to make that personal connection when you're so script oriented. But instead, if you do have like a playbook or you have a few ripcords for the agent to really leverage or use, it can make that much more conversational. It can make that much easier for a new patient or a caller to feel more personal or more personal connection. And that's really what we kind of build out based on the practice. So we know that every practice is a little different. Every practice handles phone calls a little differently. So instead of saying, hey, here's your script, go implement it, we will say, okay, here's what we're hearing on initial phone calls. Here's where a lot of the flip ups or a lot of patients are not being booked. Based on this, let's implement A, B, and C and see if that helps improve it. And that goes in part to one, the customer experience, making sure that it's a better experience for that caller, but two, ultimately booking more appointments as well. So going hand in hand there.
Yeah, I think from my point of view, when it comes to scripts, I think having the admin team be part of that script process or the outlines, as you said, is really important. That way they're sold on it. They're not told to, just be a robot, so to speak, and just repeat over and over. It also makes the job more interesting. But I think it's more guidelines than it is scripts, in my opinion, when you want to have an effective administrator that creates that, personality for the practice to engage people on the phone and make sure that ultimately they book.
Got time for, looks like one more question here. Maybe it's a little bit more of a recap of a couple things that you are covered during the presentation. And then I want to make sure we have time just so people, if they want to be able to reach out, have access to the website, your resource hub, and just your email. So last question is really, and again, 3 or 4 questions, question variations on this, but KPIs, I think it'd be kind of nice to go cover like KPIs that maybe both of you look at, and maybe if you can rank them, I think that would be a great way to kind of finish things up.
Yeah, no, I think that KPIs, there's a saying that I'll probably butcher, but what gets measured gets managed, so if you have those KPIs in place or you have those goals, it's a lot easier for you to point to and say, hey, how are we performing, or how's our performance? With Callbox, we like to keep it pretty simple. The biggest KPIs are going to be connection, so making sure you're connecting as many phone calls as possible. So we know that 100% connection rate is not necessarily going to be possible because of after hours phone calls or calls that come in during closure, or calls that come in when everyone's on the phone already. So we know that some are going to slip through the cracks with that, but anything above 80% is a connection metric that we look for. The next is that every single appointment opportunity is requested into the practice. So requesting each and every one of those, it is a little bit easier said than done because of the nuance that comes in. But we like to see requests because we know that's something that the staff handles 100% on their side. So making that request to come in, even if it's for a consultation or evaluation, without really proceeding for a whole procedure or going through the complete steps there, even just to meet with the doctor or the office, can lead to a revenue opportunity there. So connect as the first KPI, requesting as close to 100% as possible. And then what we like to look at is booking rates, or what we call set appointments, where a specific date and time is agreed upon. So that's a little bit easier to measure because of how nuanced the scheduling platforms are now, and making sure that, okay, we have a block here available. Are all of those being set for a specific date and time? Now, where that gets interesting is if you do accept walk-ins, figuring out the way in which you can structure those walk-ins as efficiently as possible. If you do say, hey, we do have walk-ins, we're taking them at this time, it would probably, based on the walk-in number we have expected, this is kind of the best window of time. So there is going to be some edge cases. And then finally, the last KPI we really push on is what we call pursue. And that's our recall or recapturing. Any of those callers who did not connect initially, either hung up on hold, hit a voicemail and hung up, anyone who called in as an appointment opportunity but did not get requested, and then anyone that was an appointment opportunity but did not get booked, whether that's because of service availability or calendar or insurance or price, making sure that those are all recalled or recaptured. So those are the KPIs that Callbox measures. And we have kind of a metric for each connect is about 80% request invite, 100% set. We know that can be a little more nuanced. So anything around 50% of that booking rate of that specific date and time, and then pursue, that's just following up with everyone. So those are the ones that we really look at. Dr. John, what KPIs did you want to point out that are important or impactful from your side?
No, I think you nailed it. I think the ones that you brought forward are definitely the ones that people want to take note of, and really implement and understand them in their practice, because that's where best practices lie.
Well, that's great. Well, thanks to both of you. And again, thank you for spending an hour with us today. I think we learned quite a bit. The recording will be available in the next hour on groupdentistrynow.com. If you want to find out more, you can just visit Callbox's website, which is easy. It's callbox.com. You can go to the resource hub, which is callbox.com/resources.cfm. We have the phone number there. We'll list all this in the notes on the website as well. And we have Ford and Dr. John's email addresses there if you want to reach out directly to them. We probably didn't get to every single question, but both hosts will have access to the questions, and we'll make sure that we get back to you on any that we didn't answer. So thank you both today. Great information. And again, thanks to people for hanging out with us for an hour. Until next time, this is the DSO Study Club. So everybody have a great day. Thank you.
Thanks, Bill. Take care, Ford.
Thanks, guys.